Hey everyone, I want to take a few minutes and talk about frozen shoulder. I've had a lot of questions recently about frozen shoulder, what it is and why it happens. So I'm going to answer those questions first. What is it? Why it happens? And then I'm going to, at the end of the video or nearer the end of the video, I'm going to explain other types of shoulder problems. So if you have another shoulder problem, just stick around to the end and I'll explain more about why those happen. But many shoulder problems originate in a similar way to frozen shoulder. So when I cover that, it's easy to transcend into the next level. So a frozen shoulder is also called adhesive capsulitis. And there's basically a capsule around the joint. So in other words, what that means is between the bones of the scapula, or your shoulder blade, and your humerus, which is your upper arm, there's like the ligamentous tissue that's all wrapped around the joint that helps to hold those two bones together. It doesn't keep it from moving normally, but what it does do is holds the things together and limits the very end ranges of the joint. So the capsule normally is allowing for motion, but also just restricting that very end range motion. So what happens in adhesive capsulitis is that there become adhesions around that capsule that limit the motion. And typically those are motions associated with bringing the arm from sort of this position inwards, and also bringing the arm up above, bringing your sort of elbow above your shoulder height, particularly to reach the back of your head or reach your back, your upper back. Most people that have adhesive capsulitis, it's that sort of range, basically from here to here is where it's the most adhesed. So that's what adhesive capsulitis or frozen shoulder is this extra tissue that builds up there that limits the motion of the joint. Now it doesn't happen purely by accident. Your body actually puts it there. So why does our body do that? It seems like a silly thing to do. Surely we would want our joint to move. The only reason that our body would put it there is because the joint is not moving well. And generally that's going to come down to stability of the joint. Now, stability means our body's ability to hold the two bones together. So if we have any sort of joint, say they're spinal joints, we have one bone and another bone on top of it. And there are lots of muscles around the joints that hold the bones together. Now, if those muscles are doing a good job, then the joint can move without coming apart. So the stabilizing muscles actually help to hold the joint together, so that other muscles which are pulling on the joint can actually move the joint, but without pulling the joint apart. So put it this way, in our spine, the deepest muscles we call intrinsic muscles, or stabilizing muscles. And again, they help to guide the proper motion of the joint. So they're contracting enough so that the joint moves the way that it's supposed to move. If those muscles weren't, and then when they're doing that, when they're holding the joint together and allowing it to move, we know that we can maintain joint integrity. Okay, so that's joint stability and joint integrity, and also proper biomechanics. If all those muscles are working well, then the biomechanics should be relatively intact. The extrinsic muscles, okay, or prime mover muscles, are designed to actually pull against one of the bones and move it really away from its neutral or balanced position and pull it away. But it's that combination of contraction of the deep muscles that stabilize the joint and those extrinsic muscles that are pulling it apart that actually allow us to be able to move our joints through a big range of motion. So it's the same thing with our shoulder. We have very deep muscles that stabilize the joint and hold the joint together that basically help it to, say for instance, in the case of the shoulder, say this is my arm and this is the shoulder blade, it's like a ball and socket joint. It's a very shallow socket, but it's a ball and socket joint. So as this arm moves, it's going to move around in here. Now it's meant to sort of pivot in this way, okay, but it's not meant to pivot in this way. So by example, what we're saying is that some of the muscles, these deep muscles that surround the joint, actually hold those two bones together so that when they move, they maintain the right positions in relation to each other. If those deeper muscles aren't doing a good job in stabilizing, then what can happen is a joint can move in an awkward direction and cause injury to the joint, and then you can have repercussions from that. Or what will happen is your body will sense that it's unstable, and then it will use a compensatory tension. In other words, it will turn a different muscle on to try to limit the motion of the joint so you don't move it into a dangerous position. So say for instance, if I were to move my arm up like this, there are certain muscles that have to hold my shoulder together in order for me to be able to achieve that motion. If the muscles that hold me together through this motion, like say my latissimus dorsi is a muscle that comes down, this is sort of lats kind of come down in a V shape down your back, that comes up into the shoulder. It actually helps to pull the arm down so that it can actually be pulled down and stay, roll into the joint like this as your arm is coming up, okay? So it helps to hold it down. If your latissimus dorsi are weak, then your shoulder might move in an awkward position, then your body will contract other muscles to try to limit that motion. And then it will start to develop adhesions. So these adhesions are the things that are actually going to physically limit it rather than just limiting it with the muscle tensions. So when we see someone with a frozen shoulder, we're going to see that there is a physical limitation of the motion because of that adhesion, but there's also going to be some muscular components and muscular compensations as well. So that's what a frozen shoulder is. There's lots of other problems that can happen in the shoulder, and I'll explain a little bit about how those happen as well. Another example would be something like supraspinatus tendinitis. A lot of people have that as well. And what that means is there's a muscle that goes across the top of the shoulder blade of the scapula called supraspinatus, and it sits in a little groove at the top there. What it does is it comes over and it drops down over the top of the shoulder. And what that muscle does is essentially we say that that muscle will move our arm from this position out to about 30 degrees. So it's really good at doing this motion, but it's not very good past that motion, okay? So the reason it works like that is it goes over the top of the shoulder like this, and what it's going to do is it's going to pull this up like that. So it's going to pull it like this, and that's going to help to bring your arm out to the side. But then it's going to kind of get to the end of its abilities at about 30 degrees. And then another muscle called the deltoid has to kick in, and the deltoid is a sort of triangular muscle. There's three of them. That's going to kick in, and that's going to help move your arm from 30 degrees to the side further up, okay? It can move it straight out to the side. The anterior one will bring it forward, posterior brings it back. So you have these three muscles in our shoulder. When we think of our shoulder, those are the muscles that we generally think of. The deltoid is going to contract to bring it beyond that. Now, the supraspinatus is one of these deep stabilizing muscles. So if that muscle has been switched off for some reason, then it can't do that motion, for one, and it also can't help to guide that joint and hold that joint together so that it can stay integrated. So we have joint stability. So if supraspinatus is failing in terms of its strength and activation, then we're not going to be able to hold that joint in and pull it in like this as that muscle is coming across the top and pulling it. So if that starts to fail, our body says, oh, wait a minute, we don't have the ability to do that. What other muscle can we recruit to try to do that job? So the muscle that will typically get activated, or one of the muscles that will get activated, will be the deltoid, and very often the middle deltoid or anterior deltoid. And those people that say, oh, I have this really sharp pain right here, you know? And what they're doing is they're showing you where deltoid is where it's connecting into the humerus, into your arm bone. And it's painful because it's constantly contracting. Now, these extrinsic muscles aren't meant to contract all the time. So when they do, they really start to complain. They build up lactic acid. You have like little bands of tension in the muscle. But as well, mechanically, what's happening is because they're not designed to hold the joint together, like I was saying before with the spine, they're actually designed to move the joint off to the side. What will happen is when the deltoid contracts, like I said, the deltoid works best from here upwards. So if it starts working from down here and contracting all the time, what it's going to be doing is pulling this up. It's going to pull your arm up, and it's going to squash the supraspinatus tendon over the bone that goes over the top of it. So it's going to pull your arm up and squash it in there. And then you're going to have this sort of tendinitis. So one reason is for the tendinitis is it being squashed, okay, there's an impingement. And another reason just could be because there's some load on that. So that's a more complicated answer. But basically, if the deltoid is firing as a compensation for a weakness of the supraspinatus, then you're going to probably develop at some point a supraspinatus tendinitis. And you might end up developing shoulder pain and shoulder problems and mechanical problems with crunching and all kinds of other things because the joint isn't being stabilized properly. So that's another example. There's lots and lots of examples of shoulder problems, but very often they're coming down to the stability of the shoulder. So one last point I'm going to leave you with is we have to ask that question, why aren't these muscles switching on? Why would we have a weakness of this muscle? Well, there's a couple reasons. Well, there's many reasons actually, but I'm going to give you the two most common reasons. One is that these deep muscles were also called the rotator cuff muscles. A lot of people have heard of those. They're very, very important muscles, and most of those are controlled as from what we call posterior cord or particular nerves that are associated with extensor muscles. So because those are extensors, they have a different kind of control mechanism than the flexor muscles. So what that means is that the muscles on the front are flexors, so they kind of bring you towards fetal position, and the muscles on the back are extensors, they bring you away from fetal position and kind of open you out. So the flexor muscles are big and strong, and they're really used to being activated, and the extensor muscles are smaller, thinner muscles that have a harder job to sort of counter the flexor muscles. So if we're doing lots of things that use lots of flexion, then we can actually build up an imbalance where the flexor muscles are strong, like doing lots of bench pressing and things like this and lots of press-ups. If you're not working your back enough, you can end up with an imbalance. There's other mechanisms in terms of how our brain is controlling and calming down these flexor muscles, because if these muscles aren't being calmed down, then they get tight, and then these get switched off because they work in antagonistic relationship to each other. So one problem could be that, again, the flexor muscles are too tight, and switching these muscles off. And another could just be that those muscles aren't being used enough. So doing exercises are going to build up these muscles, like the shoulder muscle I put up on my YouTube channel, is a really great way to try to redress that balance. So that's one way we can try to resolve some of these things. However, there is another element to this, is that the stabilizing muscles in our shoulder, or really all of the muscles in our shoulder, are anchored essentially in our neck. So our neck and our spine form the anchor points for all of the muscles of our arm. So anytime I try to lift something with my arm, the muscles that are allowing me to move my arm are actually anchored to my neck. So if there's some problem with the stability of the muscles in my neck, such that if I had muscles that were weak on one side and I tried to lift something with this arm, which is going to pull my joint this way, but the joint isn't stable, the joint will move too much, and your body will sense that the joint's moving too much, and it will switch off that muscle in the arm. So sometimes we see, we test someone's muscle in their arm and their arm is weak. Or you try to lift something and you can't lift something over your head, you can't hold your arm over your head, it's weak. That could actually be something in the shoulder, or it could be something in the neck. So you always have to try to trace things back to where the origin of these issues are. So I always try to look at the origin of the stability, looking at the stability of the spine first. So in this case, it would be looking at the stability of the neck. If the neck is stable, I look at the stability of the shoulder. If the shoulder is unstable, we have to say, is this an imbalance of these muscles, or do we have to try to switch these muscles on? What is the process that's causing this instability or this imbalance? And then from there, you can start to work on other joints and other issues within that. So there's a kind of a multi-layered approach to how to resolve these things. If I were to just pull on your arm, it might not be the best thing for you. We probably want to look at your neck stability, because if we get your arm moving, but we don't stabilize your neck, then that's not going to be so good for you in the long term. So I'll always start with stabilizing the neck, the shoulder, and then we can start working on the joint itself. Now with adhesive capsulitis, you can actually do a stretch that releases that adhesion, makes a big loud pop, hurts for about 10 seconds, and then your shoulder works. So if you have that sort of problem, you probably want to get seen by a chiropractor or some other manual therapist who can be able to assess these things for you. So that's just a quick rundown of the types of things that can happen in the shoulder. Just one other little gem at the end of that is that sometimes people have other problems in their hands and their arms, and these problems can exist also with the neck instability. So even though someone might have a problem in their wrist, we still have to consider what's happening in their neck, because it may have developed a muscular pattern of tension, which is associated with a response to an instability in the neck. So there's there's lots of things we always have to trace back, but I always like to focus on spinal stability first. Then I work on proximal stabilizers, and what that means, proximal means close. So the proximal joints of the extremities, okay, are your shoulders and your hips. So shoulder exercises and hip exercises would be secondary to spinal strengthening exercises. So really the best place to start is strengthening your spinal joints, then strengthening your shoulders and your hips. And then from there, you have sort of an even playing field where it's much, much easier to try to be able to resolve joints with a lasting efficacy. So that in other words, once we know that your joints, all of the joints in that chain are strong, then it's going to be much, much easier to resolve other joint problems. So thanks for watching that. It's about 50 minutes, so thanks for sticking around. And I hope that's informative to some of you. There's lots more shoulder problems. If any of you have any more questions, just drop them into the comments and I'll be glad to address those in the comments or in another video. Again, thanks for watching.